Hi, and welcome. If you're here, it's because either you or someone you care about can't stop pulling their own hair. This serious mental disorder is called trichotillomania. In this video, we will explore how to neutralize it, but first, it's important to precisely describe how it works and where it comes from. To start off, let's address one misconception. Trichotillomania is not an obsessive-compulsive disorder. Many sources mistakenly confuse it with OCD simply because both disorders involve repetitive actions. However, there's a crucial difference. Trichotillomania provides pleasure, which is absent in OCD. This characteristic is what should classify trichotillomania as a non-substance addiction. In fact, it's an addiction to oneself. How does it start? With trauma. As a child or a teenager, you may have experienced a violent event that deeply affected your mind. This event led to a profound violation of your core assumptions about the world, leaving you in a state of insecurity. To release the pressure, trichotillomania manipulates your reward system, the result of millions of years of evolution. It motivates you to engage in actions with the promise of pleasure. In the case of trichotillomania, pulling your hair becomes a way for your mind to access easy pleasure. Initially, nobody thinks, I've never done it, but today I'm going to pull my hair. Instead, you may touch your hair to comfort yourself, similar to how a mother soothes her baby. Unfortunately, repeated touching of your hair leads to increased stimulation of the scalp nerves. Over time, you consciously recognize the comfort it provides and begin touching your hair closer to the scalp. This is when you pull your hair for the first time. When you pull your hair, you experience a sharp increase in tension, which brings both pain and pleasure. To maintain and enhance this tension, you continue pulling until a clump of hair is uprooted. The sudden release of intense tension when the hairs come out provides a feeling of pleasure and comfort. This process constantly teeters between pain and pleasure. It's this fleeting pleasure that temporarily balances the anxiety. However, similar to other addictions, the reward is short-lived and anxiety returns. Without even consciously thinking about it, you repeat the same action to relive the pleasure release. This is when the addiction to yourself begins. From this point onwards, the specific area of your scalp where the hair was pulled becomes extremely sensitive. It's as if you've created a meth lab in your brain. Your scalp constantly sends sensations akin to tiny radiations. It is tempting you to create pleasure for yourself to release the pressure caused by anxiety. The intensity of this temptation radiation varies depending on the level of your anxiety. In some cases, even a single touch of your hair can trigger it. As someone who has suffered from trichotillomania for many years, I'd like to share a brain hack that helped me tremendously. However, please note that this won't resolve your trauma. Only therapy can achieve that. To set yourself free, I recommend you to use ice. It can be highly effective in helping you reduce your addiction to yourself. When you feel the urge to pull or when it has already started, applying ice is like putting water on a fire. It neutralizes the sensitivity of the affected area on your scalp. To use this technique, you can buy any small sports ice cold patch available in pharmacy and store it in your freezer. And you can even secure it under a baseball hat or similar head covering. This will help alleviate your pain, curb the constant temptation, and reduce your addiction to yourself. Remember though, if you're personally suffering from trichotillomania, seeking therapy is crucial for long-term recovery. Ice is only a temporary pain reliever. Feel free to spread the word, and I hope this knowledge helps as many people as possible.